Now, as we heard earlier from Emily Evans, a 2-year-old boy has died in Perth amidst a horrendous flu season. We also heard from the Federal Health Minister, Greg Hunt, on how nationally this is one of the worst years. I'm going to be joined now from Perth by the Royal Australian College of GPs West Australian Chair, Dr. Sean Stevens. Welcome.
Thanks very much, Shay.
Why is the flu season just so terrible this year?
Well, it's a number of factors. Unfortunately, it is a particularly virulent strain of the flu, particularly the influenza A. It seems to be transmitted a lot more. It's peaked earlier, so this year we've seen already more flus than we have seen in any other full year in the last 5 years. It's also hitting people harder. So, tragically, we've seen 41 people die already this year, including poor young Elijah, and our thoughts are with his family at this terrible time. We're also seeing that people are still not getting vaccinated. I mean, we really would encourage every single Australian to see their GP and get vaccinated, because that's the best way to stop the spread of this awful strain.
Do you think there needs to be a new approach to flu mitigation, given, as you say, this has just been one of the worst years? And, while there have been 41 deaths in WA, there have been 30,000 cases in New South Wales. What approach to flu mitigation should we be taking that's different from what's happening at the moment?
Well, I think there's a few things that we can do. I mean, the first and obvious thing is to get vaccinated. See your GP, get vaccinated and stop the spread. Things like, just simple things like when you're coughing, obviously don't cough over people. If you are going to cough, it's actually better to cough into the crook of your arm than into your hand. Coughing into your hand can spread the illness that way. If you do come down with influenza-like symptoms, see your GP. If you can be seen in the first few days, then it is possible to start some antiviral medications which can halt the disease and prevent it spreading to other people.
I mean, we can't ever make vaccinations compulsory because, that is unconstitutional, and there's all sorts of grounds for people to object to having a vaccination. But do you think, like with, No Jab, No Play, the federal government campaign for children, do you think there should be incentives tied to getting the flu vaccine for children or for the elderly?
Yes, we'd be keen to look at anything that would encourage people to get vaccinated. It's the best form of prevention. It prevents hospital admissions, it prevents days off work, it prevents deaths, as we're seeing this year. So anything that can be done to improve the vaccination rates and get people to see their GP and get vaccinated would be welcome.
I'm pretty sure it's a myth, but one of the main reasons that people don't get the flu vaccine is that they think they can become unwell from it. This is a myth, isn't it?
It is a myth. The influenza vaccination is not a live vaccination. We give it at the time of year when there are viruses circulating. So unfortunately, people often do pick up a virus at that time. And unfortunately, I've had it myself. Trying to convince people that it wasn't related to the influenza vaccination can be difficult. But this is a very, very critically important vaccination, and to help protect yourself, but also your loved ones, and particularly those around you who are young, who are old, or who have chronic medical conditions. It's very, very important.
Thank you very much for your time, Doctor. Really appreciate it.
You're very welcome.